Hello, Washington chiropractors. I'm going to give you a quick update on the status of each of the bills we're working in Olympia, along with action items you can take to help us move them forward. HB1589, concerning the relationships between health carriers and contracting providers. This bill, reintroduced in 2026 and referred to the Committee on Healthcare and Wellness, the bill was amended in committee to include 4 transparency items carriers agreed to last year. They include a requirement that carriers publish contract information for the carrier's primary point of contact for contract negotiations, a requirement that carriers provide redline versions of updated contracts, a requirement that carriers provide payment methodology information no less than 60 days in advance of executing the contract, and for new contracts, a requirement that carriers provide access to contract information in a manner other than a secure website or portal. Action you can take. Call your House members and ask them to support HB 1589 as amended in House Healthcare Committee when the bill is scheduled for action in the House. SB 5899, creating a license endorsement to allow qualified licensed chiropractors to perform chiropractic diagnosis and adjustments on non-human animals. This bill creates a license endorsement for a licensed chiropractor to practice animal chiropractic. It requires the DC to provide proof of successfully completing an approved animal chiropractic education program within the previous 2 years, including a minimum of 210 curriculum hours, or proof the chiropractor holds a current animal chiropractic certification. Additionally, the DC must have completed 30 hours of continuing education every 3 years and paying fees as required in state statute or renewal. The bill is eligible for floor action in the Senate and has an amendment with the following effects. It establishes requirements that an animal chiropractor must meet prior to providing animal chiropractic care. It directs an animal chiropractor to maintain and share medical records with an animal patient's veterinarian. It requires an animal chiropractor to develop a protocol for notifying an animal patient's veterinarian of an emergency during a chiropractic appointment. It creates a joint task force of members from the CQAC and the VBOG and directs that task force to report on specific items to the governor and legislature by October 30th, 2030. It also requires a veterinarian who refers an animal patient to an animal chiropractor to include a copy of the medical record received pursuant to this act as part of the animal patient's medical record. It also clarifies that a referring veterinarian does not need to supervise the animal chiropractor during the provision of animal chiropractic care, and it is not liable for the care provided by the chiropractor. Also, it requires a veterinarian within 14 days of denying a referral to provide the animal chiropractor and client of an animal patient the contraindications of why the referral was denied and creates an effective date of July 1st, 2027. Action you can take. Call your senator now and ask them to vote yes on the amended SSB 5899 when it is scheduled in the Senate. SB 6071, standardizing overpayment recovery requirements. This bill was amended in the Senate Health and Long-Term Care Committee and now prohibits carriers from requesting refunds from health care providers on claims payments unless they do so in writing within 12 months of the payment, and prohibits carriers in cases related to coordination of benefits with another carrier from requesting refunds from healthcare providers on claims payments unless they do so in writing within 18 months of the payment. Action you can take. Call your senator and ask them to support SB 6971 when it is scheduled for a vote in the Senate. SB 5845, modernizing and clarifying timely payment requirements for health carriers. This bill requires health carriers to pay clean claims within 30 days and requires health carriers to request any additional information needed to process a claim within 21 days. Action you can take. Call your senator and ask them to support SB 5845 when it is scheduled for a vote. HB 2106, Health Carrier Modification Notice. This bill requires health carriers to provide notice of significant payer contract modification to the relevant healthcare provider or facility contract representative 90 days before the effective date of the modification. This bill detail was amended into the previously cited HB 1589. Please be sure to contact your legislators as outlined in this video to help keep the WSCA's legislative agenda on track. Collaborating with you to advance legislation improving your practice landscape is one way the WSCA is helping chiropractors help patients.